Hello everyone, I am Dr. Lalith, a cataract, cornea and refractive surgeon at Amrit Hospital, Chennai. Today I am going to tell you a few things about LASIK. LASIK eye surgery is one of the most common refractive surgeries which is performed in the world, and it is usually done after the age of 21 who do not wish to wear glasses. So what do we do in LASIK? See, LASIK, we use a laser called the excimer laser to reshape the cornea, and once the cornea is reshaped, the power goes off and the patient is able to see things clearly without glasses. So who are the patients who are eligible for LASIK? One is age. The age has to be minimum of 21 years old and the refraction has to be stable. Refraction means there should not be any change in his glass power after the age of 21. And third thing is that we usually, whenever a patient comes for LASIK, we do a test called topography. The topography basically takes all the measurements of your eye, the cornea and everything, and it tells us whether the patient is eligible for LASIK or not. And apart from that, we also examine the retina, we check the power of the patient, and once everything is fine, we proceed with the laser. And the type of laser which we do at our hospital is called Contoura. So what do we mean by Contoura? Contoura is a technology where, apart from getting the power corrected, it also corrects the minor irregularities in the cornea. So you can see whenever there is a road, there might be slight bumps here and there. Similarly, you can compare the cornea to a road and it might have a few irregularities or a few bumps here and there. So by doing a normal LASIK, we correct only the power. We don't correct these minor irregularities or bumps on the cornea. But with Contoura, we take 22,000 readings on the cornea. We take data from that and we actually treat the minor irregularities which are present on the surface of the cornea. So what does it do to the patient's eye? So basically the advantage which the patient gets is, apart from getting his power corrected, his vision is going to be super sharp and the contrast is going to be great. So everything which he sees, the colors will look bright and natural compared to a normal LASIK. So this is what happens when we do Contoura LASIK, and hence I recommend Contoura LASIK to all my patients. So we make sure we take all these measurements properly and we go ahead with the treatment. And in LASIK also there are two types of LASIK. One is called the conventional Contoura LASIK, in which we use a small blade to make a flap in the eye. And once the flap is made, we fire the laser and put the flap back. The flap can be made. In LASIK, what we do is we make a small flap in the cornea. So you can compare it to a dustbin with a lid. So it is like attached at one point. So once we make the flap, we fire the laser and then put the flap back, and the flap goes and sticks, and this usually takes a week or 10 days to heal. And there are two techniques for making this flap. One is we can use a blade, which we have been doing for past 25 years. It's a good enough technique, but it had a few flaws, and hence there came a new technology called bladeless LASIK. In bladeless LASIK, what we do is we use a laser instead of a blade to make this flap. So when we use a laser to make the flap, it is much more precise, it is much more safer, and the visual quality is also better compared to the blade LASIK. So once we make the flap with the femtosecond laser, we generally we lift the flap, we fire the laser and put the flap back. So this is the bladeless technology is much more safer and more precise way of getting LASIK done. And to add on to that, the advent of Contoura, the addition of Contoura improves the quality of vision to a great extent. So I would recommend that everybody should come to our hospital and get Contoura Vision done, because that is going to change their life. And this is why we call this surgery a magic surgery, because the patient who had a power of 6, 8 the previous day, he is able to read everything very, very clearly the next day, and they are so happy, so thrilled at the end of the surgery. That is why we call this as magic surgery, and this has helped us change a lot of lives. Patients who were so dependent on glasses are totally independent of their glasses, and they can do so much of their adventure activities without glasses. So that is the beauty about Contoura LASIK. Thank you.